This video is part of our first aid series, and what I'm going to show you is how to stop an asthma attack. And what I'm going to do is move over to some of the anatomy when it comes to the trachea and the bronchioles, and talk a little bit first about asthma itself. So in this picture on the left hand side, you can see that we have on our throat we have a larynx, and then that transitions into a trachea. So when it comes to our windpipe, our respiratory system, it really starts all the way up at the top of your throat, and as it moves down into your airway, your upper airway, it moves into your trachea. That's pretty important because the terminology that we usually use with asthma might be to say that it's a bronchial asthma and be concerned about our bronchial tubes. The anatomy of your trachea actually transitions into your bronchial tubes or your bronchi, which is actually further down into your chest. So those are pretty good things to know. Also, it's good to know that the asthma, the obstruction to your airway might not be down inside of the lungs itself into the bronchi or the bronchus going into the lungs. It could actually be into the trachea, so don't discount the problems with the trachea itself. On the right hand side, the upper right hand side, we see that we have two bronchi that are coming off of what would be the trachea up at the top. And then those would branch several times as it branches inside of the lungs themselves. And then bottom right hand side, as I move this picture up a little bit, we see that there's where it says the respiratory system, and then normal airway, asthmatic bronchial, and inflamed bronchial tubes. So again, we usually think of the bronchial tubes as being inflamed on the inside of them, which is true. You have different layers on the inside of your bronchial tubes, and that's what starts to restrict some of your airflow. But we also need to think about the trachea, and we need to think about what happens on the outside of those tubes, because when a person has an asthma attack, it could come on when a person has an asthma attack, it could come on very suddenly, but chances are that there's inflammatory things that are happening on the way to that asthma attack. It could have been that there's fluid in inflammation, and with inflammation actually comes more fluid in certain areas of your body, and in this particular case, it's fluid on the inside of your trachea, and then as it splits about down here and goes into your lungs, those would be the actual bronchial tubes or bronchi leading into bronchus inside of our lungs. You still have to consider this part here. So the trachea starts about right here as far as the name of it, but we still have an entire airflow here, a tube here that still has problems. So we're talking about right here as it comes down into your sternum, and then you have your clavicles right here. So why I'm pointing this out, I want to get into a couple more anatomy pictures, and then I'll show you how we're going to hopefully resolve an asthma attack as it happens with weighted tuning forks. Get to the next picture here. So this kind of just shows the same thing I was talking about before. Excuse me, where the trachea comes down, it splits into the bronchi. Those branch further out into the bronchioles, which are going into our alveoli inside of our lungs. This next picture is a cross section. This is actually where the bronchus, where the different tubes are branching off to each other. So we see a cross section, and first I want to point out the fact that there's these little bands around not only our trachea but our bronchioles. The main branches for the bronchioles are pretty much they're pretty much made the same way that the trachea is made, as far as there's these cartilage or cartilaginous bands around them. That's an important factor when it comes to what I'm about to show you. And then as they branch out, you have problems on the inside where if there is an inflammatory response, we get swelling, which is really fluid. The same sorts of things that we work on the outside of the bronchial and trachea tubes, which is there's interstitial fluid that tends to swell up the tissue. It's the same process that we work on for pain and mobility restrictions on the outside of these respiratory airways. So keep in mind that as these tubes get more and more fluid in them, that's restricting the airways, and then what usually happens is some sort of allergic reaction might happen that would, and it could also be sports related or somebody exercising and not be able to get enough air, and then you could have an asthma attack. An asthma attack usually means that you just can't get enough air altogether and you're really suffocating. So consider the fact that things are going on in the inside of these tubes, and as we work with our tuning forks in the method that we use within New Earth Healing Center and that we train in NEHC Academy, when we use the weighted tuning forks, we're really trying to release fluids. It's the same interstitial fluid that we're trying to release elsewhere in the body. When we put the vibrating tuning fork on these locations, it gives the ability for the fluids that are pressurized inside these spaces that can't leave for whatever reason. When you have the vibration and the stretch of the fascia, the collagen layers that are surrounding, that basically make up the structure of the bronchioles and the trachea, the same mechanisms that occur elsewhere in the body still occur here. It's still made with the same process. It's fascia and collagen fibers that make up the structure. It's still interstitial fluid, and of course it could be mucus that's secreted from the mucous membranes within the trachea and the bronchial tubes. So consider that it's still fluids that are inside the tissues. And then this picture is just showing the fact that we have that trachea that's moving down past the rib cage or inside of the rib cage. So we have some challenges there of getting to these locations. And it makes sense that your rib cage is really designed so that you're protecting your lungs, and so most of the things you're trying to get to are already restricted from actually physically getting to it. I know that a lot of people will consider putting the tuning forks right on the bone. Let me explain that for a few minutes here. When you take a weighted tuning fork and you put it on the bone and you're vibrating it, so let's say this tuning fork is vibrating and I put it right on my sternum. The challenge here with that particular motion of putting it right on the bone and expecting it to affect the soft tissue underneath the bone is that it has a hard time getting the mechanical vibration through that bone. Because what happens in acoustics and the science and the physics of acoustics, the movement of molecules that are vibrating next to each other. Again, sound and vibration, they're all mechanical forms of energy. So there's actually molecules that collide with each other as the vibrations spread out away from the tuning fork. When you get vibrations into the bone because you're pressed on the bone, most of the vibration actually stays within the confines of the bone itself, because you have the outer layer of the bone, then you have the inside of the bone. And what tends to happen with vibration, mechanical vibration, is it stays within a location inside the bone because of the different densities of what's happening outside the bone. So bone kind of has like its own center inside the bone, and that's where most of that vibration is going to end up staying. In the science of acoustics, we call that a sound channel, and that's where sound tends to get stuck within that area. So I wouldn't recommend coming right onto the bone itself or even the ribs and trying to get at these bronchioles. We have another method that we can use. So I just wanted to discuss the bone itself. That's not where you need to get to. There's other places, soft tissue, there's other locations that we can go to, especially for an asthma attack. And then also on this screen, it's showing the fact that the lining of the lungs itself, we also have to consider that there's this pleural cavity, which really means that the lungs themselves are surrounded by it's inside of it's inside of a bag, and the bag is made with collagen fibers as well. And then it's really called a pleural cavity, which would be the space in between the outer bag, which is right up against the walls of your rib cage, and then there's an inner bag which lines the inside or the outside of the lungs. So that tends to fill up with fluid. It's called pleural fluid in pleural cavity, but that's still interstitial fluid. And as a person that has problems with breathing and respiration and coughs a lot, a cough in and of itself ends up becoming a lot of trauma in the soft tissue. And as fluid starts to build up on the inside of these tubes, the tubes start to expand too. We rarely think about the outside of the tube and the problem that's happening with the soft tissue on the outside as things expand. When fluid pressure builds up within parts of our body, it either has the ability to expand outwards or it's caught within the confines of usually bone, meaning that we're building up fluid in our pleural cavity for our lungs, and it presses up against our rib cage. It has nowhere else to go. Same thing with our brain. When our brain has its own mechanism for dealing with fluid pressure, different than the rest of our body, because there's the big challenge of the fact that your brain, the area inside of your skull can only expand so much, and then it's left to press inwards, and then you have a lot of problems with your brain. And so we have to consider the fact that every time we have asthma attacks or the things that are leading up to an asthma attack, bronchial spasms and things like that, where there's a cough. My son had bronchial asthma for years, and one of the things that he had happen all the time is every time he would take a breath in, there'd be a a cough. Now, coughs are really traumatic, like I said, to the soft tissue, because you have harder substances that are pressing and rubbing against soft tissue, and that creates its own inflammatory process. If you've ever taken anything hard and kind of rubbed against the outside of your or the outside of your skin, you'll start to see where there's a problem. There's a swelling and there's fluid buildup underneath that. The same thing happens with rubbing against the ribs and the outside of the ribs too. We have all this space, this tissue right here that also gets filled up. If you ever take a person that coughs quite a bit, has COPD or emphysema or asthma like that, where they're always coughing, you can feel right here, and I bet their outer layer of tissue here will be filled with fluid, and it'll be a little bit sore to press against them in this area. That's because those ribs are just, the ribs are just rubbing against the tissue and adding to that problem. So we can't always think of the tubes themselves as constricting as the only problem that we have with asthma. We have to think about all the tissue that's outside of those areas. Outside of the lungs, the rib cage causes problems. Outside of the rib cage, the superficial layers that are really called superficial fascia and deeper superficial layers, or superficial adipose and deep adipose, and then we have layers that move across each other like that. That's in the very outer layers, probably the first inch or so. Here it'd probably be a little bit, there's different thicknesses throughout your chest. I want to get back to the fact that you have in the throat, surrounding the trachea, there's more of this superficial layer, which means the outer layer just underneath your skin. When you start to cough as well, when a person has, again, when you have asthma, sometimes there's a lot of coughing involved in it. And even as you talk or as you move your neck and as you lay down and go to sleep and you lay on it, you lay on your neck, you cause a lot of fluid buildup there as well. And you can get fluid buildup without having inflammation, although most of the time inflammation, it just means swelling and more fluid in the tissue. It's really the fluid that's coming out of your arteries, the plasma that's coming out of your arteries. That's the fluid we're talking about. So swelling on the inside of your tubes. The trachea has to be considered. The bronchioles are down here. They're usually kind of hidden away. And then as that person is coughing and having problems, you got to consider where's the access point here to get into the places that you can actually do something about. So here we have what I've been pointing to on my own self. If you look up at the top there where your clavicles are going horizontal from your sternum to your shoulders, you have that clavicle bone, and then you have your sternum itself. It looks like a little tie there. So at the top there, you can just barely see where the thyroid section and the cartilage surrounding the thyroid actually transitions to this trachea. And the trachea, remember, it has bands of collagen around it. And basically it keeps the structure of your windpipe. And that's important too, because remember, again, just like the ribs, if you're coughing a lot, your trachea and your bronchioles, that's rubbing against the soft tissue on the outside of it, and we start to get this buildup of fluid pressure on the outside of the tubes as well. So where the best place or location would be just above the sternum and in between the ends of the clavicle, right there where the throat is. You can see that there's a hole there, and there's a lot of soft tissue that tends to get built up. So what we would do with an asthma attack, the first thing we would do is take our weighted tuning fork, and I happen to have a 128 hertz weighted tuning fork here, and I'm going to strike it, and I'm going to put it right there where I showed you that above the sternum and in between the clavicles. What I'm going to do is actually press inwards with a little bit of pressure. There is plenty of space there. There's about that much space there between where your skin is normally and actually the first layer of your trachea. So you can actually press in quite a bit. You can see that as I'm talking, the tuning fork itself kind of moves a little bit. There's a little bit of play there. You can press in quite a bit. So this is the first step towards responding, first aid response to an asthma attack. It seems kind of counterintuitive because you think that the bronchioles are in your chest, but this is one of the biggest problems. The trachea is just like the bronchial tubes, and you get this buildup. And we're not only dealing with the fluid pressure on the outside, but by pressing down in this first part, we're actually getting that vibration down into the outer layer of the trachea, which is also going to release some of that fluid. Vibration from a tuning fork like this, when it's pressed against those layers, fascia layers, it actually allows some of the fluid to move or diffuse across those layers. So if there's pressurized fluid that can't leave, that's why we think that asthma is permanent, because we don't know how to manage our fluid, our pressurized fluid, but we can with tuning forks like this. So once again, first step with asthma attack, find out where that hole is, and you should be able to press with your finger right in that hole if a person is normal and doesn't have a lot of coughing and asthma and bronchial problems and throat airway problems. You should be able to take your own finger and put right in there. You should be able to feel all the way down to where that trachea is. All right, so first action, you're striking it and you're pressing right down inside that hole. I'm away from all the bones, so I have bones on three sides of where my tuning fork is, and I'm pressing down until I can't press anymore. I'll talk about any extensions and anything like that here in a minute. So that's all I'm doing for this first strike. I also want to point out, look at where I'm holding it. I'm holding it right up here on the yoke, and this is where your best grip is. So when you're striking it in whatever manner, in VFRT and weighted tuning forks at NHC Academy, we strike it right there on our hand and get a good strike and just press down right in the soft spot and just let it run all the way out. This right here should immediately start to get that airway back. And if you do it to yourself, wait for that vibration to run out, then take a nice deep breath. If you're having even problems with bronchitis or something like that, it's some of the same some of the same situations where if you're coughing a lot, you might want to do this to yourself and to keep that airway clean. Of course, there's more work to do here. There's a lot more trauma happening here, and our VFRT therapists have been trained how to take care of more things than just this. Again, this is part of a first aid series. And then the secondary thing, what you should do after that, is another strike. Well, what I'm going to do is I'm not going to press down that much, but I'm going to push in a little bit, but I want to bring the stem right up against the bone itself, the trachea, the top of the trachea right here. So the stem is resting against the top of the trachea. Excuse me, the top of the sternum bone. Excuse me. Yeah. So the sternum bone is right here, and press in just a little bit and just kind of rest or press down on the stem to rest it up against that sternum bone. And then strike it again. We're going to press in just a little bit, not as much as we did before, and bring it over towards the clavicle, the end of the clavicle. Let it run out. And then do it again. Press a little bit down, and then bring it up against the clavicle end that's going this way. The reason why we're doing this, if you remember when I said what happens to harder structures when you have a lot of coughing, you're still rubbing the ends of those bones like this, and that's causing a lot of the problems still with the fluid buildup on the outside of your trachea. So those would be the immediate things that you would do, and there should be some preventative things that you should do. We would use our VFRT, our vibrational fascial release techniques, and there's all sorts of things that we could do leading up to and post. There will be some other things that we would do VFRT-wise to the chest to make sure that the person doesn't get up to that level where they have an attack. So there are some things that you can add onto the bottom of these. You see that I have a 15 millimeter gem foot on this side and a 25 millimeter on this side. And it just happens to be the clear crystal, quartz crystal. And I wouldn't recommend using these. And I know that the ends of these, this is 128 hertz. We call this a barefoot fork. Nothing added to the end of this. There's a little divot, little hole on the end of this. So if you had bare skin and you try to press down, it's probably the amount of force that you have to go in and pressure you have to go inwards. It's probably going to hurt the person. So what you should do is take their shirt and get some barrier there, a cloth barrier, and just make sure there's a barrier there. When you go to extensions like this, you start to reduce the overall vibration. You really need that fork to be barefoot without any extensions, because there's the dynamics of the tuning fork itself being weighted like this. There's actually flexing going on across the entire length of this tuning fork. Not just the tines themselves, but the entire thing is bending and flexing. You get most of your vibration off of this flexing happening because of the weight on this end, and it's unbalanced. When you start to add things on the other end of this, on the opposite end of the weights, what you end up doing is starting to dampen out and lessen the vibrations that are happening in different directions down on this end. And you start to reduce the overall strength and amplitude of the vibrations that are coming off of this. Remember, it's not just the weights themselves and the tines that are moving at 128 cycles per second, but it's also the flexing of the entire tuning fork here. So this adds weight, lengthened stems add weight, and dampen out the strength of that tuning fork. And the 25 millimeter is adding an awful lot of weight. This would be the 6 millimeter. It looks like there's not much to this, but just remember, this is a lot of metal on the end of this, and this is a dampening it dampens or starts to shallow out the strength of that vibration. There's reasons and purposes for these extensions, but in this case, you don't need anything like that. So what tuning forks will work with this? I had the 128. I do recommend a fork of that length. When you have a longer tuning fork like this, that would be the 64 hertz tuning fork, this probably works, and if that's the only tuning fork you have, then use it. The challenge here compared to the 128 is the length of the tines. when they bend, there's a lot less force to that bend that's happening here. So that compared to the movements that's happening down on the stem, it's probably less force than it is with 128, because you notice the different lengths of the stems here, or excuse me, the different lengths of the tines, which would be this part here. They're a lot different in this one. And you got to consider the fact that these are metal. So those tines have to bend this way and this way. And since these are so long, the bending part of it, of course, the overall balance of this tuning fork is much different than 128. So the strength that's coming off of here is going to be a lot different. And then when you go on the other end of that, this is 256. The challenge here is, again, the movement of these tines. These tines, when you strike them, I mean, you can hear it, and you can strike it against something a little bit harder, but think about the amount of movement that's going to happen with this. It's a little bit, or actually it's a lot shorter than the 128, which is about half the frequency of the two. So just from the fact of the length of the tines, that's why we tend to favor this one when we're working on soft tissue, our collagen fascia layers and the fluid that goes along with it. We tend to stick with tuning forks just like this for those reasons. So in this next picture, I'm just showing that the fact that, you know, if we're still trying to get to the bronchial tubes, the backside of the body still has a lot of challenges in getting to that section or those parts of the lungs, and of course the bronchial tubes inside of the lungs. So this picture is showing a study that we did ourselves here at NEC Academy. That big silver part is the end of the tuning fork, the 128 hertz tuning fork that I just used. You can see that even the little marks as they were creating the tuning fork, or had it on a lathe and cutting the material away. So the right hand side is the tuning fork actually pressed up against fascia, and then you can see that the interstitial fluid, when it's vibrating, can diffuse through a fascial layer. And sometimes fascia just isn't in a three-dimensional thing. They're sometimes in layers, and this particular layer in our study was off of a cow, and this would have been the outer layers of the cow, the superficial adipose layers. And the outer layer of that particular layer, we were able to show that the samples that we worked with in our study still had interstitial fluid. We got it fresh to make sure that we still had the fluid available, as opposed to buying a steak at the store. And we were able to see the interstitial fluid actually diffuse through those layers and depressurize the fluid on the other side. So we were able to see that if we strike our tuning, or if we didn't have a tuning fork or just press down on a layer, yeah, you're probably going to get a little bit of fluid squeezed out through whatever's containing the interstitial fluid. But vibration and stretching the fascia collagen fibers actually allows diffusion of the fluid out of that space, and it happens pretty rapidly. So we have at NEHC Academy two main things that we train on. On the left, you see vibrational fascia release technique. On the right is vibrational chronotherapy. On the left-hand side, VFRT is what we have therapists throughout the world. We have trainers throughout the world, and this is where we provide paid intensive training and online training. This is weighted tuning forks on the body, where we're releasing fascia and the fluid that's pressurized. Right hand side is chronotherapy. That's mainly unweighted tuning forks. We do have free training on our website for that. And if you'd like to visit our website, it's nehcacademy.com. And we also have a Facebook group called NEHC Academy. And thank you for watching our video.